About 185,000 amputations occur every year in the United States. These result in devastating impacts on the lives of those affected. Disability, psychological problems, and loss of income opportunities usually follow people afflicted with limb loss. The options after limb loss are limited for most people. Prosthetics are usually the main option. For many, they offer restored function as well as obvious aesthetic benefits. However, not all prosthetics will provide a worthwhile value for an amputee, and as a result, many will not use them. The only other option then is limb transplants. Now, limb transplants generally are not appealing for most amputees. Psychologically speaking, surgically attaching foreign limbs seems off-putting for the average person. Then there is the issue of cost and waiting for a suitable donor. But one question that generally trumps these concerns is the limb transplant worth it? In other words, does a limb transplant's benefits outweigh the potential risks involved in attaching it? Limb transplants are currently a complex issue in their own right. But before we understand them, let's analyze a topic that's rare but closely related. That's the procedure of limb replantations. Reattaching the original limb is the first option for anyone that has had an unexpected amputation. The reasons for this are obvious, but the general issue is whether or not it's feasible. A limb can be unexpectedly amputated in several ways. Crushes and blunt force trauma are the worst-case scenarios and generally mean the lost limb is too damaged to reattach. The most ideal case is something known as a guillotine cut. That's a clean incision with no damage to any muscle or nerve tissue. So long as it does not result in a catastrophic blood loss or other problems, a reattachment can happen. For a surgeon, this is the perfect condition for a limb replantation. But what if that's not the case? Exactly how much damage can a limb take before it's no longer viable to reattach? The first issue that's looked into is blood flow, or how much of it can be restored. Veins and arteries that allow blood circulation are critical to salvage. Without enough veins, there is not enough blood flow. The limb is then susceptible to more damages in the muscle and nerve tissues. Nerve repair is also important and will determine exactly how much sensation and control can be restored. If the nerve or vein gap is small, it's usually not a major problem. However, when the gap is large, an intermediary material is needed to connect the pathways. Ideally, surgeons will harvest a nerve or vein from some other part of the body and use that to replace the missing portion. Synthetic veins are an option, but there are generally some potential problems that have to be taken into consideration. The first is whether or not these synthetic veins can be planted in the areas they need to be. This is like scaffolding. You might have the right materials, but you need a structure to build it in place. Another problem with artificial material for veins is something called thrombogenicity. Basically, whenever you have a foreign material coming into contact with the blood, undesired reactions can occur leading up to blood clots. This can create further problems. Nerves are a little trickier, and the action will depend on the size of the nerve that was damaged. Doctors will first try to repair the nerve and put it in replacement tissue called conduits. If there is a large gap, they will put in what is called an autograft. This is nerve material from another area of the body. The autograft is then replanted in a manner to reconnect the circuitry in the area of the amputation. Allografts are based on the same idea, but rely on donor nerves instead of the patient's own. Both come with their advantages and drawbacks, but the surgeons will generally know which one is a better option for the individual. Regardless of the options available, there will always be a point where there just isn't enough tissue to salvage any meaningful function or sensation. This puts many people in the tough position of opting to be an amputee instead of having a limb that is a burden. That's not to say that a limb with no function or sense has no use. It can certainly help with things like stability and metabolism. However, the obstacles it causes could outweigh any upside the patient finds in them. It will always be a difficult choice for both the doctors and the amputees. In many cases, there might not even be a clear-cut answer. When the choice of replanting the original limb is gone, limb transplants are the only option for people who want to reattach the lost extremity. The one major benefit that limb transplants have over replantations is that you generally can make sure enough tissue, nerve and veins, are present in the donor's limb. Thanks to this, it's reasonable to assume some level of functions and sensations will be restored after surgery. In fact, most patients of limb transplants are satisfied with abilities they regain after the attachment. So, what's the downside? It's a pesky little phenomenon called tissue rejection. Many of you have probably heard of it before when reading on things like organ transplants. Your body is not familiar with the foreign limbs, so unless the donor is an identical twin, the body will naturally call on its immune system to kill the tissue in the foreign limb. For obvious reasons, you don't want that happening, and doctors have to prevent that. They do so by prescribing immunosuppressant drugs to prevent the body from attacking the limb. The main issue then becomes the long-term effects of these drugs and whether or not they are worth it. The drugs generally make one more susceptible to infections and various health problems. They also take a toll on the kidney and reduce lifespans. In fact, these issues are so prevalent that 62% of the cost of a limb transplant is incurred after the surgery is done. So, is it really worth it? For many scientists, the answer is simply no. But for the recipients, they see it as worthwhile, regardless of the significant health issues. Keep in mind, doctors and patients have different philosophies to this matter. Doctors are bound by an oath they take to not cause harm. So it makes sense for them to be wary of these invasive limb surgeries that are followed with years of heavy medication. The patients, on the other hand, are generally motivated by social and psychological factors. Being able to touch and feel loved ones is a major issue for many amputees. For some, the presence of a limb provides a mental relief that allows them to feel whole again. These are things that can't be replaced with prosthetic limbs, at least for now. At the end, it's the quality of life that makes the main concern for these participants rather than the longevity. For scientists, the issue will be, how can these transplants happen with minimal suppressant drugs? So far, the biggest hope seems to be gene therapy. This would work by genetically modifying the cells close to the transplant region to not attack the new tissue. However, this concept is probably decades away. It is also possible that limb transplants can become obsolete if bionic limb technology advances to a point where both sensation and control are no longer an issue. For more on that, check out our video on bionic limbs. Either way, it will be interesting to see which way limb transplants go. There is certainly more we could talk about on this issue, but we had to condense for the sake of time. Let us know what you think in the comments section below, and thanks for listening. If you like this video, please click like and subscribe.